guys, I'm Naila, a third year medico from GMC Thrissur. So this video will be a brief introduction to MBBS course. So as you all know, MBBS is a 5.5 years course. You'll be having first, second, third and final year, and then there will be 1 year internship. So since you decided to come to this path, you should be knowing what you will be facing in these 4 years. So talking about first year, you'll be facing 3 subjects: anatomy, biochem and physiology. Anatomy is the toughest subject of all. You'll be studying with the human anatomy, and at first you'll not even be able to understand what they're speaking. It takes at least 1 month to be familiarized with the anatomy language actually. So let me show you my books. There is something, so you can refer either Vishram Singh or B.D. Chaurasia. So this book is head, neck and brain, and then you have abdomen and lower limb, and then you are having upper limb and thorax. So these are the books that you are going to refer for anatomy. So if you are a person who loves to read standard books, you should try reading Gray's Anatomy. At first, you are going to be baffled by the load that is produced by this anatomy, but there are some tricks which you can use to handle this topic. It's doable. So the next subject is physiology, where it is more or less similar to biology that you learned in your 12th standard. So this is the book that you are going to use for physiology. So this is GK Pal. So this is the volume, the thickness of GK Pal. So instead of GK Pal, you can also use Gita. And then you're having another subject which is biochem. So biochem, it is a simple subject for some people, and some people don't really like biochem. So there is only one book for biochem. First year you'll be having classes from 8 to 4. You'll be having dissection classes, practical classes and theory classes. Anatomy practical, you'll be mainly drawing with HNE pencil, and physiology practical, you'll learn how to take BP, how to draw your own blood and calculate the bleeding time and clotting time. And biochemistry, you will be dealing with urine analysis. But in first year, one thing you have to notice, you might be the topper of your school. You must have gotten like a full A plus in your 10th and 12th, but in MBBS you won't be getting a score above 90. It might be possible for some people, but our main target is to pass these exams, and it's okay if you fail. Like the first time you fail, you'll be very overwhelmed, and you'll be having exams every other day. So you should know how to balance your life. You should take care of your health. You should enjoy life, because you're struggling too hard for these past years for NEET, and finally you entered the medical college. So you have to enjoy your life along with studies. Now coming to second year, when you go from first year to second year, there will be a drastic transition. You'll feel like you are going into heaven. Like from that workload, you'll be going to somewhere where you don't have to do any work. So the subjects in second year is pathology, microbiology and pharmacology. I'm not having my books right. In second year, you'll be having your usual theory classes, as well as you'll be having your practicals. Along with this, you'll be having something known as postings. You'll be posted into medicine, surgery, pediatrics and all other departments, and it's going to be very interesting the first time you enter into the hospital for clinics. So in second year, along with this, talking about the subject, pathology is the base of medicine. You must know pathology and pharmacology properly in order to learn medicine. So pharmacology is the study of drugs. You'll be learning about different drugs. You'll feel like a doctor when you're learning pharmacology. And pathology, you'll learn about the organism which is causing the disease, the gross pathology of the organs which is affected by the disease and all that. And in microbiology, we'll be dealing with the microbiological aspects, the test, laboratory investigation that you're supposed to do in case of a disease and stuff like that. So overall, second year is very interesting, and it is a balanced year where you can do what you love. Now coming to pharmacology and microbiology. So pharmacology is a love and hate subject. That is, you're having a small book known as Shanbag. That is a book that all of us use to pass the university exam. But if you want to go to in-depth knowledge about this pharmacology, you can use KD Tripathi. So after that, you are having this microbiology. Microbiology, Apurva Shastri is the one and only book that you can use for microbiology. So all these 3 are doable subjects. You can enjoy your second year life as well as study for the exams. There is one speciality for first year as well as final year. In both these years, if you fail the final university exam, you can write something known as say exam. But if you fail that say exam, you'll be having something known as year back, that you have to repeat that year. But in second year and third year, if you fail the say exam as well as the university exam, you can continue with your batch and then you can write it again with the junior batch. Now coming to third year, it is the chillest year of MBBS. It is known as the honeymoon period of MBBS because we had only two subjects, that is community medicine and forensic. But from 2023 batch onwards, I guess, you'll be having community medicine, forensic, ENT and ophthalm in third year. That's actually a good thing because the burden in final year will decrease. Book for forensic medicine, this is mostly used in Kerala. So it's a very interesting subject where you can learn about things that you never knew before, the laws, the snake bite and things like that. Now coming to community medicine. It's a very vast subject. Let me show you. This is the textbook for community medicine. Just look at the thickness of that textbook. You won't be reading this whole book. Each college has a specific Nutka type of book for this community medicine. So in Kerala, we are having a book known as SIA for community medicine. So before the university exam, we just mark the points of SIA into this book, or you can read SIA itself for community medicine. Now you have something known as electives. Electives is a 1 month break that you'll have before your third year university exam and before starting of the final year. So over here you can choose your favorite clinical and non-clinical topic. So it will be allotted to you based on your first year or second year marks. In our college it is based on our first year marks, but in other colleges it is based on the second year scores. Okay, so this electives, I chose surgery as my clinical branch, head trauma, and it was really interesting. I'll be making a video on that soon. And for non-clinical, I chose pharmac, MI. So along with this, you'll be having something known as skill lab, where you'll be taught how to suture, how to perform CPR, how to remove the helmet. So in final year, you'll be dealing with 9 subjects. It's a very hectic year. The final year itself is of 1.5 years duration. So you'll have to study a lot in this final year. You'll be having medicine, surgery, OBG, pediatrics, and then you're having minor subjects like derma, ortho, psychiatry, radio, and anesthesia. So after final year, you'll be having internship. Internship is 1 year duration. After that, you'll become a doctor. So one final piece of advice I would like to give you all is, please don't take MBBS because someone pushed you into this course, and please don't take this for money because you won't be getting to so much of money in this course. Take this only if you have the passion to learn medicine. So after MBBS, during internship, the amount you will be getting is 26,700 rupees over here in Kerala. And after that, when you work as a GP, you'll get 40,000 to 50,000, and during your PG course, you'll be getting some 55,000 to 60,000 per month. That will be the money that you're earning in your 20 to 30 years old. Guys, that's it. I hope you liked it, and if you liked it, please do subscribe. So I'll be sharing my NEET journey and more things about MBBS. So that's it. Bye.